Medical Laboratory Services. Introduction to the module. This module will teach you about the role of medical laboratories and laboratory technologists, and the services performed by different medical laboratory departments. You will also gain an understanding of the standards a medical laboratory requires. This module also covers details of accreditation and medical legal issues. Topics to be covered. Role of medical laboratory services. Major roles of a medical laboratory technologist. Rules and regulations of medical laboratory. Medical laboratory request forms. Keeping laboratory records. Departments within the laboratory. International laboratory quality standards. Organizational chart of a typical hospital laboratory. Accreditation of laboratory. Medical legal issues. Role of medical laboratory services. Medical laboratory services have a key role in promoting good health and preventing and curing illnesses in a nation. They give accurate scientific information to those who treat patients and monitor their response to the treatment. Monitor the development and spread of disease-causing organisms, pathogens. Determine control measures against major diseases. Prioritize health concerns and allocate resources. Major roles of a medical laboratory technologist. Some of the medical laboratory technologists' roles are to carry out laboratory tests using established methods. Discover solutions to administrative, technical and research problems. Collaborate with other health professionals to conduct community-based research. Provide professional consultancy on laboratory establishment, renovation and upgrading. Uphold the rules, ethics and codes of conduct of a medical laboratory. Rules and regulations of medical laboratory. Medical laboratory request forms. Medical laboratories receive different requests daily. These request forms must show the patient's name, age, sex and address, the inpatient and outpatient number, the tests and dates requested, the type of specimens provided, the name of the medical officer requesting the form and to whom it should be sent. Any other relevant information. Keeping laboratory records. The laboratory must keep a record of all test results, containing the patient's name, age, sex and address, the type of specimens provided, the type of tests performed, the date and results of the tests. Departments within the laboratory. There are a large number of departments within the medical laboratory. These are organized in different ways because of the types of services offered, many of which relate to other departments. Hematology. Hematology is the study of blood and its elements, plasma, red and white blood cells, and platelets. The majority of laboratory examinations are performed on blood samples, involving either the liquid or solid portion. The basic test is a complete blood count, CBC, which analyzes the red and white blood cells present. CBC can reveal many diseases, and there are hundreds of other tests that can be performed. Coagulation. Coagulation is often combined with the hematology department. The tests performed are a very important element in treating several chronic diseases. Only the liquid portion of the blood is used in coagulation tests. Coagulation tests determine abnormalities in the clotting of the liquid portion of blood, plasma. Clotting is important in preventing blood loss, but clots can cause strokes or heart attacks. Two typical tests are prothrombin time, PT, and activated partial thromboplastin time, a PTT. Immunohematology, blood banking. The blood bank stores and supplies blood for transfusions. The blood bank performs some diagnostic tests. Blood banks supply blood cells, platelets, and plasma. Blood is tested for compatibility by antibody-antigen reactions. Clinical chemistry. Chemistry laboratories perform the tests that are required daily. These tests are often grouped into panels. These routine tests can be performed quickly. The presence of different organic and biochemical constituents in blood helps identify diseases. A chemistry department's instruments can perform thousands of accurate tests per hour. Serology, immunology. Serological tests determine the immune response to an organism. These tests are performed in several sections of the laboratory by a unique department. The immune system protects the body from harmful microorganisms while diagnosing the illness. By performing indirect tests for antibodies produced, a laboratory worker can identify the microorganism present. Microbiology. Microbiology detects and identifies pathogenic microorganisms. Clinical microbiology studies bacteria, viruses, fungi, and parasites. Most microbiology departments perform routine tests, growing and identifying bacteria on a nutritive medium from patients' specimens. Clinical microbiology also determines the appropriate antibiotic for patients' treatment. International Laboratory Quality Standards. There is a set of minimum quality standards which laboratories must meet. These include a well-organized structure, including a national laboratory focal point, regulatory mechanism and laboratory structure. National standards for competence, infrastructure, equipment, tests, and techniques. An adequate number of qualified personnel to implement a national laboratory plan. A quality management system for laboratory services. A selection and standardization of laboratory supplies and reagents. A national management policy for laboratory equipment. A National Laboratory Information Management System, LIMS, to provide relevant data and information. Safety measures and waste disposal in line with national guidelines. Laboratory financing that is part of the overall health financing plan and various budgeting processes. Organizational chart of a typical hospital laboratory. Please read this chart. Please read this chart. Please read this chart. Accreditation of laboratory. Accreditation is the formal recognition that an organization is competent at specific processes. The provision of accreditation should be undertaken impartially, be objective, transparent and effective. Use professional assessors and technical experts who are ethical and competent in accreditation and the relevant technical fields. Medical legal issues. There are various legal issues relevant to clinical laboratories, including informed consent. Informed consent means that a patient is aware of, understands, and agrees to the required testing. Implied consent only covers routine procedures. Informed consent is required for complex procedures. If informed consent is required, the patient must be told why this is necessary and have the opportunity to ask questions. Confidentiality. Information about the patient and the results of their tests must be confidential. A patient's authorization is required before this information is revealed to non-healthcare individuals. Chain of custody. As laboratory tests may potentially be used in a court of law, their analysis must be documented at each step. This is called the chain of custody and is used to prove that no alteration has taken place. Other legal considerations. Patients should expect an acceptable standard of care from healthcare professionals. This is the degree of care a reasonable person would take to prevent another's injury. A serious injury or death resulting from a failure to do so can result in legal action, tort. Summary. In this module, we have colored the following areas. Medical laboratory services provide scientific information to those who treat patients, monitor and determine measures against diseases, and prioritize health concerns and allocate resources. Some medical laboratory technician responsibilities are carrying out laboratory tests, finding solutions, conducting community-based research, and offering consultancy on establishing and upgrading laboratories. Different laboratory departments offer different services, such as hematology, coagulation, immunohematology, clinical chemistry, serology, and microbiology. Laboratories must meet international laboratory quality standards, which include measures such as a certain number of qualified personnel, quality management systems, and safety measures. Accreditation is the formal recognition of an organization's competence. There are several legal issues clinical laboratories face, such as informed consent, confidentiality, and chain of custody.